I'd like to now welcome Dr. Eric Wittkugel from Cincinnati Children's Hospital Medical Center, who will open with anesthesia for your child, what to know, and what to ask. Thanks a million. Take good care.
Good afternoon. My name is Eric Wittkugel. I'm a pediatric anesthesiologist here at Cincinnati Children's Hospital, and I consider it a real honor and a privilege to speak with you about anesthesia for your children or for you if you have epidermolysis bullosa. I have spent about 20 years taking care of children with EB, and it has without a doubt been one of the most rewarding experiences in my personal and professional career. I've had the opportunity to write, to publish, to speak, but the thing that really means the most to me is to walk into the hotel lobby this morning and to see two of my EB friends that I've taken care of since the age of about 10. At that time, Tim, their brother and sister, gave me a very nice crayon drawing of a fish. I still have that. And I took a picture of him sitting on my lap. Well, Tim is now a college student with a wonderful GPA. His sister has graduated from college. Tim was valedictorian of his high school class. Melissa was a 3.8 GPA in college. They have been such an inspiration to me, and it has been such a joy to kind of go through life with them as I've seen them repeatedly. So that's why I'm standing here, because it's really an amazing experience for me. And I have a few goals for our time together today. I'd like for you to better understand issues of anesthesia for your child or for yourself. I'd like to give you some practical information for how you can help your anesthesiologist take better care of you, to give you a few important questions that you might want to ask, and also to give you some tips for what to do in case of an emergency. I know that many of you probably come to a center that is familiar with patients with epidermolysis bullosa, but there may be an occasion where you find yourself in a different place because of an emergency situation. And I want to give you some tips on how you can navigate that situation the best. And then lastly, I want to help you better evaluate the quality of care that you're receiving so that you can make good decisions for yourself or for your children. So with that in mind, we'll just jump right in with the anesthesia part of things. I don't need to tell you that it's a skin disease that's genetically determined. The big features are blister formation and scarring, skin and mucous membranes that separate from the underlying tissues because of abnormal skin architecture. And as an anesthesiologist, we think of basically three types, and the severity is related to the depth of the abnormality in the skin. So what we're seeing, the most severe type is going to be the dystrophic epidermolysis bullosa, which occurs at the deepest level. Junctional is more superficial, and epidermolysis bullosa simplex is most superficial. The difficulty that the disease presents for anesthesia kind of correlates with the depth of the lesion. The deeper the lesion, the more challenges there are for us to provide a safe and effective anesthetic. So EB simplex is arguably the mildest form. The lesions typically heal without scarring, and there's usually not too much difficulty in providing safe anesthesia for patients with EB simplex. With junctional EB, they all have blistering. This may improve over time, and typically just some skin care is the main issue that we need to pay attention to. However, when we come to dystrophic epidermolysis bullosa, there's many organ systems that are affected by that. And the most severe form, the recessive dystrophic epidermolysis bullosa, is characterized by skin blisters all over, as well as involvement of the mouth and your esophagus, the food pipe. These patients have acquired fusion of the fingers and toes, and it's the most incapacitating, disfiguring form, and also the form of epidermolysis bullosa where patients most commonly require surgical intervention. So let's jump in and talk about anesthesia care. And what I want to do is share with you a little bit about what I as an anesthesiologist think about when an EB patient comes to me. And I want to talk about the whole process from beginning of the pre-anesthesia evaluation all the way through different aspects of anesthesia care. So when I first think about evaluating a patient who has EB, I want to know what related diseases are present, because there's a number of them. And I want to be sure that they're in the best possible condition, and I want to see if there's anything we can do in conjunction with your other physicians, your other specialists, to improve those before we start anesthesia and surgery. So some of the coexisting diseases that we'll see are beginning with pulmonary first. There's decreased pulmonary function and frequent respiratory infections. Obviously, you want lungs to be in good shape when you undergo anesthesia. In terms of the extremities, there's often contractures where we need to position the patient carefully, and IV access can be difficult. With the GI system, narrowing of the esophagus causes swallowing problems and difficulties eating, so we need to take care and think about those issues to provide a safe anesthetic. Anemia may be seen from chronic disease or chronic blood loss, and there are metabolic deficiencies and deficiencies of iron, zinc, vitamins, and just overall kind of a rundown nutritional status in patients with EB. And that just makes the patient a little bit more vulnerable to difficulties during surgery. Eye problems such as corneal ulcers may be seen, and kidney problems occasionally happen.